With medical technology advancing so dramatically over the past 20 years, people are able to live longer with diseases that they would have normally succumbed to in the past. Acute medicine in America is among the best in the world. But are all these advancements making Americans lazy when it comes to maintaining good health and preventing disease?
Most Americans have too much faith in medical technology to take care of their chronic health issues. However, medical technology has not necessarily resulted in improved health. Because of this failure to address causes, triggers, and amplifiers, chronic illnesses in America are either stable or on the rise. Heart disease, obesity, diabetes, and high blood pressure continue to stay the same or increase despite advancements in pharmaceuticals and procedures.
America is experiencing a large increase in the number of people who suffer from chronic illnesses. Once again, medical advancements in technology and treatments help those afflicted with these conditions reduce symptoms and live fuller lives, which is a good thing. However, in many cases, that traditional medical model often doesn't address the underlying disrupted physiology that leads to the development of these disorders.
The term disrupted physiology refers to the idea that our physiology, the way our body works, is disrupted or not working in its full potential. This disruption usually begins many years prior to the development of a particular symptom complex or condition. It's well known that the degeneration in the brain associated with Parkinson's disease occurs many years before symptoms of Parkinson's disease arise. Addressing these issues early on in a personalized way forms a foundation of the ideal medical approach.
Addressing the healthcare needs of patients in the 21st century is complex. A new medical model called functional medicine is quickly becoming the standard in addressing these health issues.
Functional medicine focuses on improving the function of the body rather than focusing solely on the reduction or removal of symptoms of disease. It empowers people to take control over their own health. Functional medicine acknowledges that we are a whole body and the health of each part affects the whole. The Functional Medicine program at the Institute for Restorative Health houses a wide variety of like-minded healthcare providers under one roof who collaborate to provide the best personalized care to all patients.
At the Institute for Restorative Health in Davis, California, Dr. Eric Hasid and his staff are practicing functional medicine with an interdisciplinary team approach. Patients are often evaluated by multiple care providers in a team format in order to create a personalized restorative health plan. Their approach is cutting edge and addresses the real needs of patients.
I was sick for quite some time, so by the time I came to the IRH, I was pretty sick and was willing to do just about anything. And I was looking for an office that would complement and have alternative methods since I wasn't getting well after seeing numerous doctors and trying numerous medications. So coming here was a big light at the end of my tunnel, finally.
The Institute for Restorative Health helps to find real solutions for real problems. IRH embraces functional medicine as the ideal foundation for the medical management of its patients, addressing a variety of areas of intervention, including medical nutrition, detoxification, mind-body medicine, sleep restoration, exercise and physical structure, hormones, metabolism and anti-aging, and medical interventions.
We look at the whole person, both physically and emotionally, and a series of evaluations are often necessary to do this. Each of our providers is skilled to do an initial evaluation. We thoroughly assess nutrition, activity levels, sleep quality, mood. We look at environmental toxin exposure or medication interactions. And then working together, we formulate a personalized treatment plan to address the areas of concern. Typically, this is done in person, but we can do evaluations over the phone.
It is becoming more clear that the environment we live in, along with our lifestyle, including diet and exercise, influence how our genes function. By improving gene function, we can reduce the incidence of diseases that may otherwise have occurred.
Genetics signify our potential, but they're not absolute. You may have the potential to develop cancer or heart disease because it's in your genes, in which case it becomes more essential that you take steps to avoid those diseases, like quitting smoking, reducing drinking, and eating a more vegetarian-based diet. You can take it a step further by taking laboratory tests that assess gene mutations or deficiencies, and there are supplements that can overcome these deficiencies.
The effect of stress and negative emotions like anger, resentment, sadness, loss, worry, or fear is a huge factor in managing chronic disease and pain. I have the best seat at the Institute for Restorative Health to witness new hope and joy that is experienced by our clients when mind-body tools are adopted as a new way of life.
Sleep is essential to optimal health. 50% of Americans claim that they do not feel refreshed in the morning, Lack of quality sleep leads to increased prevalence of chronic illnesses such as obesity, high blood pressure, fatigue, pain, depression, and poor thinking. Our team at the Institute for Restorative Health helps clients achieve restful sleep with natural supplements, acupuncture, chiropractic, massage, and mind-body techniques.
We're all exposed to a wide variety of toxins each day. From preservatives, cleaning agents, metals, and all these affect how healthy our cells can be. By improving our body's function of the organs we eliminate with, the kidneys, the lungs, the skin, our GI tract, we can do that through diet and exercise and deep breathing and even sweating like a sauna. All that improves how we reduce our toxin load.
Men and women throughout life have a lot of hormones surging throughout their body. After the age of 35 and with chronic illness and stress, these hormones will decline and people will start not feeling as well. If we replace hormones appropriately, we can actually improve sense of well-being, we can actually improve disease incidence, and actually optimize aging safely without the risk of developing cancer down the road.
Nutrition is the basis of health. It was Hippocrates who said, "Let food be your medicine and your medicine be food." We truly are what we eat, and most people believe that we can eat whatever we think tastes good and makes us feel good without concern for its health effects. Our goal is to teach people that healthy food looks good, tastes good, and makes you feel great. And once this diet is balanced, often we can use supplements to help reestablish natural health in the body.
Well, exercise helps to prevent the decline in function and lean body mass associated with aging, essentially slowing down the hands of time. Finding the right exercise program and, most importantly, optimizing the function of the body are all essential components in reestablishing a healthy state. As a chiropractor, I work with patients to provide tailored chiropractic treatments and develop specific exercise programs to both minimize injuries and optimize the overall function of the body.
Some of the mind-body tools that we teach are simple biofeedback techniques, guided visual imagery, neurobehavioral programs, and breathing exercises. Building an effective toolbox of coping strategies is one of our goals here at the Institute.
I've taken my health into my hands and I'm taking control, but I can't do it without Dr. Zeed, Dr. Vispignani, now Dr. Vo, who is helping me with my osteoarthritis, and Rasa Sami, who is helping me with the acupuncture. I'm not leaving. I'll bring a cot. I'm not going anywhere. I've changed my insurance carriers so that I can remain being seen here at this facility. This is what I want, and I wish there were more of them. I wish I could tell everybody about it because I know it could help other people.
The Institute for Restorative Health believes it is critical that we not wait to get ill before we try to get healthy. IRH is proud to offer telemedicine consultations for those who are unable to be evaluated in person. This service is best suited for relatively healthy individuals interested in anti-aging medicine or health maintenance tune-ups. For more information about the Institute for Restorative Health or to make an appointment, contact them today or visit their website at 4irh.com.